Hi, my name is Catherine D'Ambrosio, and this particular blog entry addresses the question of who pays for nursing home care. And I use the name nursing home, but nursing homes go by other names, including skilled nursing facility, rehabilitation facility, and thankfully one that's going by the wayside, an old folks home. As I've told you in the previous blog, nursing home care is very expensive. It's generally somewhere between $4,000 and $8,000 per month for a nursing home, and that'll vary depending on your region and a host of other factors. About half of all nursing home care costs are covered or otherwise paid for out of private pockets. So this means that the private savings and investments of individual elders and their families are used to pay for nursing home care. The other 50% of nursing home costs are paid for by Medicare, Medicaid, or private insurances. Coverage by any of these three main insurers is not generally determined by an elder's nursing care needs, but by a bunch of other factors. And I'll cover the ins and outs of each of the three main insurance groups, Medicare, Medicaid, and private insurance coverage of long-term care, in another blog entry. A couple things I'd like for you to know is the rules for who pays and under what circumstances can be very complicated. And so there's some things I want you to know. The United States does not have filial liability laws. So in other words, children are not liable for paying the debts of their parents. So if your parents don't have enough money to pay for a nursing home and you happen to be wealthy, you do not have to pay for their nursing home care. Now that doesn't mean you can't, or it's not a good idea, or it wouldn't be a good thing to do. It just means that you can't be held legally accountable for that. The second thing is that by the time an elder requires continuous care, the kind of care that you would get in a nursing home, most elders have depleted all or nearly all of their personal financial assets, and consequently most elders cannot afford to finance their stay in a nursing home for very long. So the United States has set up Medicaid, but accessing Medicaid and accessing Medicaid payment for nursing home care are sometimes very, very complex kinds of things. Just because your elder needs the type of care being provided in a nursing home doesn't mean that Medicare, Medicaid, or a private insurance company is going to pay for it. Nursing care is very, very expensive, primarily because nursing care has to be provided by human nurses or human nursing assistants. And human labor, no matter who provides it, whether it's an Ivy League educated, master's prepared nurse, or it's someone who dropped out of high school and took a 75-hour course or 2-week-long course on provision of basic nursing care and is making minimum wage, no matter where you fall in that range of nursing care is very, very expensive because human labor is expensive. So I hope this particular blog entry has been, again, a little bit helpful to you, and thanks again for stopping by.